Royal Hospital, and I'd like to welcome you all to this Facebook Live Scleroderma Raynaud Association UK session, which is on medicines management. So over the next 45 minutes to an hour, I'm hoping to answer any questions you may have about medicines that you're taking already for your Raynaud's and Scleroderma, or perhaps you've read about medicines and treatment that are used to treat your condition and would like some more information on those. I'm also wary and aware that over the last 3 months or so, the COVID-19 pandemic and lockdown has put extra strain and stresses on people with regards to potentially access to their medicines or temporary stopping of their treatment. So if I can help with any questions you may have about that too, I will try my best. If you can just put any questions that you may have onto the Facebook page, and then I'll answer those as they come up. I've also had some questions submitted to me from the Scleroderma Raynaud UK website, which I believe you have posted online, so I will also try and answer some of those as well as we go through the session this evening. If you can, as you're watching this, like and share the page, then that will help spread the word about Scleroderma Raynaud UK, and hopefully reach out to more of the patient community who may benefit from this session. Okay, so just wait and for some questions to come through. Just give people a few minutes to log on and type in any questions they may have. Okay, so just while I'm waiting, I'll just answer some questions that have been emailed in, which may be useful for some of you. Just bear with me 1 second. Okay, so we've had a couple of questions from Deborah. So Deborah, I believe you're taking or have been taking ranitidine to manage your acid reflux, and those of you that are on ranitidine will know that recently there's been a supply problem with ranitidine and it's been very difficult to get a hold of. Deborah, there is an alternative, so what we would try and do is probably switch you to a drug that's very similar to ranitidine, which is called famotidine. So that's another medicine that works in a very similar way to help with reflux. It helps suppress acid production in your stomach. So that's an alternative. You can ask your GP or rheumatology consultant to prescribe that for you. So that's famotidine. An alternative that may be suitable, and you may have tried this before, is a medication called omeprazole or lansoprazole. So their medicine's called proton pump inhibitors. So they're slightly different, but they have the same job, and they're very good at reducing reflux in your stomach. So you could ask your GP to prescribe those for you, or again link in with your rheumatology specialist who's managing your condition. Deborah, I think you asked another question as well. You have limited cutaneous systemic sclerosis, and you say you've been told not to take anti-inflammatory medicines because you have this condition. You can take them. I think the reason you've probably been advised not to take them is sometimes they can cause indigestion. They can also sometimes put your blood pressure up a little bit. So sometimes we do try and advise you to steer clear of these. But it is safe for you to take, and sometimes anti-inflammatory medicines can be really, really effective at helping with joint symptoms which can be associated with systemic sclerosis. What I would advise though is before you take any anti-inflammatory medicines, do check with your rheumatology specialist that it's okay for you to take those and it's safe for you to do so, because they're not necessarily appropriate for everybody. Other medicines that you can try, you say that you've been taking dihydrocodeine, which is a medium strength painkiller. You can also try taking regular paracetamol. Usually if you take it regularly it can be quite beneficial, so that would be 2 tablets up to 4 times a day, and you could take that alongside your dihydrocodeine and also with an anti-inflammatory medicine if we consider that safe for you to do so. And the other thing that can sometimes be beneficial or sometimes not as effective for people with scleroderma, particularly if they have a lot of skin tightening, is to use what we call topical anti-inflammatory preparations. So these are things like ibuprofen gel or diclofenac gel, which you can actually rub onto your to your skin around the affected joints, and that can sometimes be beneficial in helping relieve the symptoms of joint pain. Won't necessarily help with reducing the inflammation, but it may well help reduce the joint pain. Okay, so I'm just scrolling down now to see if any questions have come in. Okay, so if I just go on to answer another question that I've had through by email. So Alexandra, you're on lots of different medicines for the management of your systemic sclerosis. So you're on mycophenolate, prednisolone, hydroxychloroquine, sildenafil, bosentan and esomeprazole, and you now need to take iron supplements as well, so, and also calcium supplements, and it can be quite tricky fitting these all into the day and knowing when you can take them and what's best to take well, with what medicines and in what order you should take them. And you ask about when you should take iron, because we quite often advise that iron is taken well away from other medication. So when you're on a lot of medicines, obviously we don't want your whole day to revolve around medicine taking, which is what it can feel like a lot of the time. So what I would say to you is, ideally with iron, you do need to take it away from other medicines if you can, because it's more effective. But if you can't, don't worry too much. If you can take it an hour to 2 hours away from your other medicines, that's great. If that doesn't fit in with your day, and you do need to take it a bit closer to your other medicines, then that is fine too. Because otherwise you potentially, the whole day then revolves around your medicine taking and you don't have time for anything else, and that's not great either. So if you can take it well away from food and other medicines, brilliant, but if not, don't worry too much if you have to take it closer to your other medicines. What we may find then is the iron isn't as effective, and you might need to take it for a little bit longer before your anemia improves, but really I wouldn't worry too much about that. Okay, so we've got a question that's coming from Karen asking, can you take ibuprofen when you're on iloprost? So iloprost is a medicine that's used when you have Raynaud's, and particularly if you have Raynaud's that's a bit more severe and a bit more resistant to our first choice treatments like nifedipine. If you have problems with your Raynaud's to an extent where you potentially developing ulcers on your fingers particularly, and they're not healing very well, then we may admit you to hospital to have iloprost infusions. So iloprost is given as an infusion every day, normally for about 5 days. It's normally a 6-hourly infusion each day, and what the iloprost does is it opens up small blood vessels in your fingers and your toes and your peripheral circulation, and that helps with wound healing and helps improve your Raynaud's. Now you can take ibuprofen when you're on iloprost. I'm not aware of any reason why you can't do that. What we do when you're on iloprost is we do stop any medicines that might lower your blood pressure. So if you're on any blood pressure medicines, or you normally take medicines like sildenafil or nifedipine, then we would stop those while you're on the iloprost infusion, because we don't want your blood pressure to drop too much. And iloprost itself, while it's very good at helping improve your circulation, any medicine that does that tends to drop your blood pressure a little bit as well, so we just need to be extra careful. I hope that helps, Karen. I don't know whether there's any other reason. You've just said you were told not to. I can't see any other reason why not, unless there was some other reason that your doctor did recommend that you did stop taking the ibuprofen, but normally we would carry that on unless there's a particular reason not to take it. Hope that helps. Okay, so just to answer another question that's come through by email, just bear with me 1 second. Okay, so Elaine has asked, she's on mycophenolate. So mycophenolate is a medicine that is used sometimes in systemic sclerosis because it can help with joint symptoms of systemic sclerosis, and it can help slow down some of the symptoms associated with systemic sclerosis. So it's an immunosuppressive medicine, um, and it over a few months will help improve some symptoms associated with scleroderma. So mycophenolate is always prescribed and monitored by your rheumatology centre, um, and you can carry on with it for quite a while, Elaine. So obviously, as long as we're monitoring you closely and we're checking that you're tolerating the medicine okay, you're not experiencing any side effects, and we will be doing regular blood checks while you're on the treatment, just to check that you're getting on okay. If your blood checks are all fine and we think that you are responding to the mycophenolate and it is helping your condition, then you can continue it. And obviously your consultant rheumatologist will be keeping quite a close eye on you to check that that you're getting on okay. And if they had any concerns and they thought that there were any issues with the treatment, then they would either first of all perhaps reduce the dose of your mycophenolate, or then go on to perhaps stop it if they needed to. But there isn't an indefinite or a definite period of time that you have to stay on mycophenolate for. You mentioned that you're also on sildenafil for your Raynaud. So sildenafil is a medicine that we use quite widely now for the management of Raynaud. So this is a medicine that we would generally use after you've tried medicines like nifedipine, and sildenafil, also known as Viagra, is a medicine that opens up the small blood vessels in your feet and your hands and helps improve circulation. And so that helps improve Raynaud's, and it can be very effective. So you mentioned that you take it for acute flares of your Raynaud's. Other people might be advised to take it continuously just to try and minimise the number of Raynaud's flares that they do have. You ask about advice for pain management. So for general joint pain, which we've mentioned already, can be quite often associated with systemic sclerosis and Raynaud's, then we would recommend first of all simple painkillers like paracetamol, taken regularly, so 2 tablets up to 4 times a day. If it's appropriate, you can also use anti-inflammatory medicines if they're considered okay for you to take. There are cases where anti-inflammatory medicines might not be appropriate for you, but you just need to check that with the specialist that's looking after you. So the first anti-inflammatory medicine we probably would try would be ibuprofen. Another one that we may use will be one called naproxen. Other medicines that you may be able to use, so you could use the topical anti-inflammatory medicines that we've talked about before, or you may need to progress to use stronger painkillers, perhaps codeine or very weak doses of morphine sometimes to control your pain. It really depends on what type of pain you have. There are other medicines that we can use sometime. There's a medicine called amitriptyline or pregabalin or gabapentin, which can also be used if your pain is perhaps considered to be associated with nerve type pain. So there are the medicines that you can use, but again we would decide in conjunction with your rheumatologist what was most appropriate for you. Okay, so Steph has asked, she says she has Raynaud's and her fingers are peeling, but nowhere else is. My husband thinks it's got something to do with my job. I'm a postie, and the weather, but I was wondering if it's something to do with the Raynaud's. Again, I think this is something you perhaps need to check with your GP or the doctor looking after you for your Raynaud's if you are under a specialist at the hospital. I think it's probably a little bit of both, to be honest. It could be due, just to your hands being out in the cold weather all the time, or it could be partly due to the Raynauds. What you can do is use regular emollients to keep your hands nice and supple. So we'd recommend something very simple, like just a paraffin based product, so something like Diprobase for example, or white soft paraffin, that you can regularly use on your hands just to keep them nice and soft, and that will help reduce the skin dryness. Okay, so Jeanette has asked if there's anything that she can use to make the lesions marks on her arms fade. She says they're very noticeable, especially if she's wearing short sleeves in warm weather. So Scleroderma can make your skin much more sensitive to sunlight, and it can leave quite obvious marks on your skin. So the best thing I think is to look after your skin, to use regular emollients on it to keep it nice and soft and supple. So again, anything as I've mentioned before, like Diprobase, white soft paraffin, liquid paraffin products, Cetraben is another one that's very good, E45. We generally recommend non-fragranced emollients that you can use very freely on your skin, and perhaps instead of soap in the shower, to keep your skin as supple as you can. I know it's very difficult sometimes with Scleroderma if your skin is affected quite badly, but using regular creams onto your skin can really improve it, and that might potentially help reduce the marks. Okay, so I think Marie is asking, so I think Marie, you perhaps have swallowing difficulties, which can be a very common symptom for people with Scleroderma. And I can't see your whole question up here, but I think you are asking about taking medicines, taking vitamin tablets, and perhaps whether you can crush them and put them into a drink. I think that's what you're asking. Please correct me if I'm wrong. So a lot of people with Scleroderma do have problems with swallowing. Generally, we'd say with tablets generally, you can crush a lot of them. You're probably best to check with your pharmacist, either your community pharmacist, or if you link in with a hospital pharmacist, if you're under a specialist at the hospital, whether the medicines that you're taking are okay to crush into and then put into a liquid, so you could put it into, for example, a fruit juice or a squash to help you get them down easier. A lot of vitamin preparations are available in a liquid formulation, so there are liquid formulations of multivitamins, for example, that you can get quite freely, either over the counter, or your GP or hospital specialist can prescribe those for you, so that might be easier for you. So with any medicines, if you do have problems swallowing tablets, please just check in with your doctor or your pharmacist, and there quite often are other alternatives that are better for you in terms of managing with reduced swallows. So sometimes reducing the size of the tablet can help, so it's quite often better to take 2 small tablets rather than 1 big tablet. Sometimes it might be that a capsule is easier to swallow than a tablet. Sometimes with liquids, some people struggle with the volume of liquid to swallow, so again we take each patient on an individual basis and check what's best for you, and discuss it with you and make a joint decision about what's the best way forward. Okay, I hope that's helped answer your question, Marie. If it hasn't, then please just post again, and I'll try and answer that and be more helpful if I can. Okay, so some other questions that have been posted online on the Scleroderma and Raynaud's UK website have been very interesting. So if I can go on and answer some of those now, they might help some of you watching tonight. And please continue to like and share this page, and hopefully we can involve more patients who this session may be useful for. Okay, so just before I do that, Randy has posted a question. So Randy's asked about psoriasis, psoriatic arthritis and Raynaud's. He says, is swallowing a problem, are swallowing problems generally associated with these diagnoses? So generally, swallowing problems are quite often probably most strongly linked out of those three conditions with the Raynaud's, because sometimes with Raynaud's you can also have a condition called systemic sclerosis. I don't know whether you do have, Randy, and that can quite often cause the swallowing problems. I'm not aware that psoriatic arthritis causes swallowing problems or psoriasis, but again, I'm not a clinician, so you're probably best to check that out with the specialists that are looking after you. I hope that helps. Okay, so Leela has said that I feel so cold all the time. I always put it down to my Raynaud's, but I literally have stopped living. So do you think there's something else I should get checked? I'm also constantly tired. So Leela, I think really you probably, this is something I probably can't really help with because it's outside my field of expertise. But if you check in with your doctor, it might be that you need some more checks, or they need to check you over just to give you some more advice on this. I hope that helps. Okay, so just while we're waiting for some more questions to come in, so one of the questions that I had from the online community was asking about biotin supplements and whether they could help with sleep. So it was someone who was having problems sleeping and whether biotin could help. So biotin's an essential vitamin. It's a micronutrient that we all produce by the action of bacteria in our gut, and you'll probably be familiar with seeing biotin listed in many shampoos and conditioners, as it's quite well known for increasing hair strength and quality. It also helps your skin, your nails, and your nervous system and general well-being. And while we don't really know if it definitely can help with sleep, I think generally if you're in better health and you have more energy, which the biotin can give you, then you may find that your sleep pattern does improve. So while I can't say definitely there's any strong evidence that it can be used to help with people that have problems with sleeping, it may be worth trying, because it can just improve your general health and well-being, and that may then help you improve your sleep pattern. Okay, so another question that has been asked from the online community. So someone asked about any medication or anything that could help with problems with swallowing and also bloating and just general abdominal discomfort. So we know that this is a common symptom of systemic sclerosis, that people can have difficulty swallowing and you can have abdominal symptoms and they can be quite uncomfortable for you. So there isn't really any particular medicine that can help with the swallowing, but what we can advise first of all is that if you can try and have meals small and often, Try and avoid big chunks of food that might be hard to swallow, for example big chunks of bread or meat, and try and cut your food into little pieces. If you do suffer from acid reflux as part of your tummy problems with systemic sclerosis, then that's when we might prescribe medicines like omeprazole or ranitidine or something similar, which helps reduce the acid production in your tummy, helps that coming back into the throat, and that can cause the discomfort of heartburn. Another bit of advice is that when you're having meals, try and eat at least a few hours away from bedtime, because quite often once you lie down, that's when the acid reflux becomes worse. So if you eat your meal earlier, you're more likely to have digested it before you lie down and go to bed. I hope that helps. Just check if any more questions are coming online. Please do keep your questions coming in if you've got anything that you'd like to ask this evening. Okay, so another good question that I had online was about supply problems with nifedipine. So nifedipine is really our first choice medicine for people with Raynaud's, and usually if you present with Raynaud's, particularly when you see your GP, this will be the first medicine that they would usually try you on. So nifedipine is a medicine that opens up your small blood vessels, helps improve circulation, and helps reduce Raynaud's symptoms. Now recently, over the last year or so, there's been real problems getting hold of nifedipine preparations, and some of you watching tonight may have experienced this. So the preparation that was always the first choice preparation, which was the nifedipine capsule, has now stopped being manufactured, but there are lots of other nifedipine products available still which can be effective. So what I would say to you is, if you get a prescription for nifedipine, you may go to the chemist, your community pharmacy, and they may say, oh, I haven't got any nifedipine in stock. So do persist, do ask them to just look and see if they can get it from any alternative suppliers. It's quite often easier for hospital pharmacies to get access to different products of nifedipine than community pharmacies, just because we have easier access sometimes to different wholesalers and different purchase lines. So if you're really struggling to get it through your GP and your community pharmacy, then do touch base with your hospital consultant if you are under a rheumatologist at the hospital, and they may be able to help get it for you. If that isn't possible or isn't successful, then there are other preparations that we can use instead of nifedipine. So there's a similar medicine called amlodipine, which can be quite effective, another medicine called losartan. Sometimes we use one of the antidepressant medicines called fluoxetine. That can also be effective in reducing Raynaud's symptoms. So there are other options. So if you can't get hold of nifedipine, please do go back to your GP or speak to your hospital specialist, and we can look at prescribing you alternative treatments, because obviously we don't want your Raynaud's to go untreated. Randy, thank you for your comment. So you've asked about whether swallowing is also part of CREST syndrome. Yes, I think it is, but again, just discuss that with your rheumatologist, but I have seen that, I think, as part of CREST syndrome. Okay, so just while we're waiting for any more questions to come in, so another question that I've had in is, which medicines should be avoided if you have Raynaud's? So this is another great question. So there are some medicines which can make Raynaud's worse, and if you do have Raynaud's, definitely should be avoided. So the most common one are beta blocker tablets. So these are things like propranolol, atenolol. So these will either be used if you have an irregular heart rate, perhaps, or a fast heart rate, or they may be used if you have high blood pressure. So they definitely should be avoided if you do have Raynaud's. Another non-prescribed medicine is caffeine, so you do need to try and cut down on any caffeinated drinks, which I'm sure you will have been advised when you were initially diagnosed with Raynaud's, because um, caffeine has definitely been associated with Raynaud's, so if you can reduce the amount of caffeine that you have, then that can help improve your symptoms. Other medicines that we should avoid are stimulants, so these are medicines that are sometimes used for people who have ADHD, so medicines like methylphenidate, obviously not as widely prescribed as beta blockers, but still something that you need to watch out for. And also, just to mention, medicines that you might not get on prescription but you might buy yourself over the counter from a pharmacy. So any medicine that contains pseudoephedrine, so that's in things like Sudafed, so it's a decongestant medication, so commonly found in decongestant tablets, but also sometimes in cough mixtures that might have a decongestant added in. So do avoid anything with pseudoephedrine in, because that can definitely worsen Raynaud's. Okay. And someone else asked online, are there any over-the-counter medicines that you can take that actually might improve Raynaud's? Okay, so another great question. So one of the things you can do is take vitamin C and E supplements. So these are antioxidants, and these are really good at improving the quality of your small blood vessels, so they will help improve your Raynaud's symptoms. So for vitamin C, we'd recommend that you have between 500 milligrams to 1 gram a day in terms of supplements. Or vitamin E, you could take 200 to 400 milligrams daily. That would be a suitable supplement dose. So you can buy those over the counter. Other preparations that you can take, so other kind of non-prescribed medicines, if you like, so we might class them as alternative medicines or herbal medicines, are evening primrose oil, starflower oil, the fish oils, so omega-3 fish oils have also been associated with improving Raynaud's, ginkgo biloba also, and ginger. Now with all of these, what I would say is, do tell your GP or your hospital specialist or your pharmacist if you're taking them, because some of them can interfere with prescribed medicine. So particularly ginkgo biloba, whilst it might be quite good at helping with Raynaud's, in some people, it can also interact with some prescription medicines, so particularly blood thinners like warfarin or antidepressant medicines. Okay, so I would say with any alternative or herbal medicines, while we understand that systemic sclerosis and Raynaud's are chronic diseases, and in this patient group you might quite often want to try alternative therapies, which is fine. Just always check in with your specialist looking after you that they're okay to take for your condition and also alongside your other medicines. And the other thing I would advise is make sure you purchase any medicines like this from a reputable supplier. So I would say, if possible, a health food store or a community pharmacy is the best place to go, because they can be on hand to advise you on what's the best product to take. Okay, I hope that helps. Okay, so Melody's said, she sent a question in. She says, I have systemic sclerosis and I'm on 40 milligrams twice a day of esomeprazole for reflux, and I also use Gaviscon at night. I'm waking up with bad acid reflux several times a week. Is there anything else I can take or change medication? So Melanie, sometimes you really are on quite a good dose of esomeprazole. I would say sometimes we can switch to a different proton pump inhibitor. So esomeprazole is what we call a proton pump inhibitor. Sometimes if you switch to a different one like lansoprazole or omeprazole, that can help. The other thing we sometimes can do is add in an H2 antagonist. So that's something like ranitidine, which we've already said is hard to get hold of at the moment, or famotidine, so they can be used alongside esomeprazole. So that might just give you some additional control of your acid reflux, and that might help improve your symptoms, as well as following the advice I've given earlier about, which I'm sure you already are doing, about small meals more frequently, and trying to cut down on caffeine, alcohol. If you are a smoker, if you can cut down on smoking, that can also help reduce acid reflux. And also trying to minimise eating late at night. Spicy foods as well should be avoided. They're another dietary food that you should avoid. Liz, you say you're taking 250 milligrams twice a day of ursodeoxycholic acid. That does sound like that's an okay dose to me, but again, just check in with your doctor, but that is a dose that I would see. Okay, so we've got about 10 minutes for more questions to come in via the Facebook Live session. So while I'm just waiting for any more questions to come in, I'll just have a look through some of the questions that have come through online and answer some of those for you while we're waiting. Okay, so someone asked online about this person had been on ibuprofen infusions, and she'd had to stop them because she wasn't tolerating them very well. She had some side effects, and was asking if there's any alternative treatments to ibuprofen. So ibuprofen is a medication, as we've already said, that's used for Raynaud. It's given as an infusion in the hospital setting. Ibuprofen can lower your blood pressure and sometimes can cause headache and dizziness, and some patients just can't tolerate the infusions. Or the infusions may not work, they may not improve digital ulcers, they may not improve the Raynauds. So more recently, the other medicines that we can use as an alternative to that are sildenafil, which you may have tried before the ibuprofen, or another newer medication which some of you may be taking or may have read about is a medicine called bosentan. Now, bosentan is a newer medicine that can only be prescribed by your rheumatology specialist, and this is a medicine that's also being used for something called pulmonary artery hypertension, but is now approved for use in patients with Raynaud's who have particularly problematic ulcers. So this is a tablet that's taken twice a day, and it opens up the small blood vessels, it helps improve circulation, and it does take a few weeks to start working. So we normally start you on a low dose of 62.5 milligrams twice a day for about a month, and then we would increase to double that dose. Now, while you're on bosentan, you do need to have some regular blood checks done, and that would usually be organised through the hospital or with your GP, and that's because bosentan can sometimes cause problems with your liver. So we do keep quite a close eye on your liver function whilst you're on bosentan. But that's a new treatment, for a relatively new treatment now for Raynaud's, which is great, and it's something that has been approved for use by NHS England, so there is funding available for patients to have that treatment. Okay. Just looking through the other questions that I've had through online while I'm waiting, just to see if there's any final questions coming through from those of you that are watching. Okay, so someone sent in a question. This person's on immunosuppressive medicines, so they're on methotrexate and they're also taking prednisolone for systemic sclerosis. And the question was, do you run a normal temperature, a normal body temperature, when you're taking these immunosuppressive medicines on steroids? And the answer is yes, you do. Sometimes steroids, if you take steroids, they can increase your body temperature just a little bit. But generally, when you're on immunosuppressive medicines, you can be slightly more at risk of picking up infections, and quite often a raised temperature is one of the first signs of an infection. So we do actually ask you, if you're on immunosuppressive medicines or steroids, to be extra vigilant, and to, you know, if you do get a high temperature, just to check if you have any other symptoms at all, and to have quite a low threshold really for just flagging this up with your GP, just in case you are brewing an infection, because you can be more susceptible when you're on immunosuppressive medicines, and sometimes it can be a little bit harder to shake that infection off. So the answer is that your body temperature should be normal when you're on immunosuppressants or steroids, and actually you need to be extra careful and just watch if it does go up, because you might be a bit more prone to picking up infections than you would be if you weren't on those treatments. Okay. Another good question that I received online was, what stimulants or medicines are best if you have attention deficit and hyperactivity disorder, so ADHD, if you also have Raynaud? So I touched on this earlier. A lot of stimulant medications which you would use for ADHD are known to actually cause Raynaud's. So really, I think in that scenario, it's a case of discussing it with the person who's looking after your ADHD and the person who's looking after your Raynaud's, and coming to a joint decision about what's safe and appropriate for you to take. Because while some of the medicines used for ADHD can increase Raynaud's symptoms, it's not to say that they couldn't be used. It's really balancing the risk and benefit for you as an individual. So that's a joint discussion to have with the specialists that are looking after you, but that's a really good question. There is one medicine that is used for ADHD which actually isn't associated as much with Raynaud's, and that's a newer medicine called guanfacine. So that could be one that might be more appropriate for you, but again, that would be a decision that your doctor and you would have to make. Okay, I've just got a couple more questions that have come in from online that I can go through with you now. If you've got any last questions that you want to ask me, then please just type them in quickly now. Otherwise the session will be ending in about 10 minutes time. Okay, so someone else asked, they are on diltiazem, which is used for Raynaud's sometimes, maybe in people that we can't use nifedipine in, or perhaps it's someone who was on nifedipine and we've switched to diltiazem instead. So the question was, I have very high blood sugar levels, is it safe for me to take diltiazem? So this is a great question too. So diltiazem can increase blood sugar levels if you are diabetic. So it isn't an absolute no for you to take the diltiazem, but again, this is something that needs to be decided jointly with your rheumatology doctor, and if someone is looking after your diabetes too, just to decide whether this is still appropriate for you, or whether it would be better to switch you from diltiazem to another medication. Okay, it is alright for you to take diltiazem even if you do have diabetes or problems with your blood sugars, as long as we're keeping an eye on things and are aware and carefully monitoring your blood sugars. Okay. So just wait for any final questions to come through. I think I've covered most of the questions that have come through to me online and have been emailed through to me too. If you have any final questions, please submit them to me over the next few minutes. Just to mention while we're waiting, obviously if you've looked, I'm sure you will have done, at the Scleroderma and Raynaud's UK website, you'll know that there's some really useful resources and information on there about medicines for Raynaud's and Scleroderma. Another useful resource is a more general rheumatology resource which you may have come across, which is the Versus Arthritis UK website. that has lots and lots of useful information on there, and patient information leaflets about different medicines that are used to treat Raynaud's and Scleroderma and other rheumatological conditions as well. And they're in a very patient-friendly format. There's lots of information on there, and also lots of general information too about Scleroderma and Raynaud's, which you may find helpful. And I would say, really, if you're looking for information about these medicines, they're probably, two of the best resources to use, other than obviously tapping into your rheumatology centre if you're under one. If there is a pharmacist that is part of that rheumatology team, then please do try and access them for help and advice about your medicines. Or perhaps your community pharmacy will be able to help you too with some more general queries. Okay. I think if there's no more questions, then we'll end this session. I hope that's been useful for those of you that have been watching tonight, and I hope it's helped answer some of the queries that you've had, maybe about some of the medicines that you're taking for Raynaud's and Scleroderma. I wish you all the very best as we come out of lockdown, and thank you very much for listening tonight. Okay, I'm going to end the session now. Thanks very much. Goodbye.